Thank you, Lauren, for that very kind, but really undeserved introduction. It's great to be back here in Portland and to see so many of my friends from the Parkinson's community. Speaking of friends, I first met Brian back in 2009. It was actually at a Parkinson's fundraiser very soon after he had publicly disclosed his diagnosis. And I approached him because I recognized in him that same fear and uncertainty that I myself had actually experienced about 12 years prior to that. That same angst that we all feel at the time of our initial diagnosis. My diagnosis, as Lauren said, of young onset Parkinson's disease came at the age of 26, just as I started my medical career as a family physician and as I was expecting my first child. To say that that was not a challenging part of my life, in fact, I probably spent the better part of a decade in fear and denial, busying myself with busyness just so I didn't have to face the diagnosis. And what little time I did spend looking at my situation, I spent really with very little guidance, trying to figure out how to be the mother, the wife, and the doctor that I always wanted to be, all while living under the shadow of this disease. As I searched for answers, the medical information was obviously accessible to me, although I did come across some very comprehensive web-based medical resources, others that, talked about the latest research news, and still others that described the details of patient support services. But I really had to weed through a significant amount of information before I could find that information that was relevant to my situation. It would have made a world of difference both to me and to the patients that I counseled had there been one all-encompassing resource to go. And it would have also made a big difference if there had been a place to connect with others about everyday, practical issues, like raising children, going to work, surviving social situations. All those questions that really, when they're answered, really improve our quality of life and allow us to live well with this disease. Because after almost 14 years of experience with Parkinson's, I really do know that there are things that we can do to empower ourselves, to become advocates in our own health, and also to take some control back in what really seems to sometimes be an uncontrollable situation, like educating yourself, eating well, trying to keep as physically active as possible, and talking openly with family and friends. Speaking of family, I now have 3 young, beautiful daughters and a wonderful husband. And through my experience living with Parkinson's disease, as much as I want a resource for myself, I really do want it for my girls as well, to help them through this experience, because this is a journey that they are on as well. I've recently completed with them a children's guide to Parkinson's that we call Shaky Hands, Loving Hands. But it will be actually so nice for them to have another resource available to answer some of their concerns. And that's another reason why I'm so excited about this initiative, that it's not only to benefit patients, but also to benefit their families and caregivers as well. And that is what my greatest hope for what the Brian Grant Foundation is doing, that they will create a resource that will allow families to work together in order to live well with this disease. And soon we will have such a place to share ideas, a place to support each other, a place that is a constant reminder that Parkinson's disease may not have been a diagnosis that we chose to receive, but how we face this challenge, ours to determine. And so while I'll always be a very vocal and passionate advocate for the medical research that I know will find a cure, I'm so very proud to stand here tonight with other people with Parkinson's to say we are not alone. We are part of a vibrant Parkinson's community made up of individuals living very unique and fulfilling lives. And who could ask for a better champion than Brian? As a basketball superstar, he was both a trailblazer and a power forward, which is very fitting because he's both of those things to our Parkinson's community. Thank you very much.